Go.
Oh, it says the same thing. All right. Uh, how you doing, Dr. Suarez? I wanted to introduce you to everybody. Why don't you give us a little bit of background about your expertise and how long you've been doing this?
Long time no talk, John. Okay, so I've been doing this I'd say about 10 years now. Former athlete, played 7 years semi-pro football, did some martial arts with you as my sensei. Health has been a big part of my life. Went into cosmetic surgery after my residency, and I decided that that just didn't really give me the that feeling inside. I felt like I really wasn't helping people the way I needed to. I really believe if you help people from the inside out, you really get to benefit every part of their life. So I started looking into hormone therapy. It's something that I've always believed in. And I started doing it back in 2011 and haven't stopped.
So it's becoming more and more accepted since you started. I'm sure you've seen the progression, and it's becoming more acceptable now.
Yes and no. Conventional medicine and big pharma is obviously against hormone therapy, especially my specialty, which is bioidentical hormone therapy, which is where you're talking about natural and compounded hormones, which are structurally and molecularly identical to the hormones that we create. So you can have higher doses and less side effects. Um, the big pharma and conventional medicine is generally against that because you can't patent it. So I can give every patient an individualized dose where you can't do that with a typical medication. It doesn't make sense for a company to produce a medication that can have 75 different dosages. They can't mass produce that. Also, since it's a natural product, you cannot patent that. So big pharma is against it. And
Oh.
there's a lot of negative pushback in medicine against hormone therapy.
So the more acceptable what they want is the synthetics that they can then basically control pretty much, right, and regulate.
Well, the biggest example of that in hormone therapy is the androgel, which was a synthetic testosterone that a lot of people, men that were going through low testosterone, were treated with prescriptions of androgel, and they just never felt that benefit that they would get from an injectable testosterone. So it's got a bad name just from that. Whereas the bioidentical form, which is pure testosterone, and the only thing that we really talk about is the base that it's in, which is the delivery system. And the best one now is a gel. There's a Versabase cream, and which usually has to be taken twice a day, but a hydrogel and a Trevis hydrogel, which is done once a day, which is far preferable. And again, higher doses, less side effects is what you're really looking at with that.
Yeah, was one of the reasons why I chose to do that, because of the less side effects, the ease of the application, as opposed to microdosing, hitting multiple times. And obviously at 52, that my health is a lot more important than, worrying about, taking a synthetic that has potential side effects. So how about your philosophy with the lab values? Like I've noticed that we've gotten labs from, people that have sent us in, they've had their blood work done, and you often say you're not getting a full picture what you're able to really to analyze what you need. So tell us a little bit about your lab reviews.
Well, as you know, just from experience, I spend approximately 2, 3 hours going over labs before I even discuss them with a patient. My lab review is approximately 40 pages of notes with a lot of information about the different labs that I would like to get. We look at inflammatory factors, we look at standard labs, and we look at a lot of combination of lab values, which would give me a better picture. One of the main things that I function on is having someone at the point of optimal range, not necessarily a reference range. The reference ranges are used to keep people in quote unquote normal ranges. And when you're not feeling well, that doesn't necessarily mean that normal range is going to help you. There's a lot of clinical evidence, and the treatments that I use are backed by the highest quality of studies, which is a double-blind cohort studies, which means the
Mhm.
doctor and the patient don't know what the treatments are and what you're getting.
Right.
And those studies do show that bioidentical hormone replacement therapy is the optimal treatment, and you can have, again, higher doses and less side effects. And there's a lot of clinical evidence that shows they don't cause cancer, they actually prevent cancer. And one of the things I always tell my patients when they think about, well, if I'm going to take testosterone or growth hormone, will I get an increase of cancer? And with women, I've heard about hormone replacement, it causes cancer. Um, when we were in high school, that's when our hormones are the highest, right? When we're going through puberty. And there's not a single person that I know of. And every time I ask a patient, do you know anybody that was in high school that died of testicular cancer, that died of prostate cancer? No.
And their
How about
normal
breast
levels are
cancer?
much higher, right, than what we would see. Yeah.
Exactly. The same thing with breast cancer and cervical cancer. Do you know anybody in high school that died of that? No. So it's
Mhm.
not the level that's causing the cancer. It's actually the decrease in level that our body's trying to adjust to that causes all the problems. We get the symptoms from the first, we get an imbalance, and then we get a deficiency.
Right, which
And
I've
the
read a lot of
imbalance,
studies myself as a professor of anatomy. I read a lot about that, the side effects of actual low testosterone and an imbalance with the estrogen. These are what's causing the major issues itself.
yeah, actually, for one of the patients, I was doing a lab value, a male patient that had a higher progesterone level, and I was discussing that with him. And as I was doing the research on his levels, I just thrown up studies of how it's been clinically proven that lower testosterone levels, which cause lower estradiol levels in men, causes premature cardiovascular disease. So it's a very scary thing that you think you're getting older and you could be healthier, but without properly balancing your hormones and optimizing your hormones, you're not getting any health benefit at all.
Now, you bring up estradiol, and I noticed that a lot of bodybuilders, they take a lot of blockers, estrogen blockers. And could you discuss why maybe that's not the best thing for that, like to completely shut down your estrogen levels?
Well, the misconception about the estradiol, there are no studies that show high estradiol levels are bad. The estradiol is what's actually giving us our cardiovascular protection, our protection against the the clotting in our arteries, the clogging up of our arteries. High estradiol has been shown is one of the few treatments that actually breaks down the cholesterol levels inside of our arteries. Okay. In the middle, the media of our arteries, which is the thickest muscle layer, it actually
Right.
breaks it down. And it's one of the few treatments that does that, other than thyroid and testosterone treatments. So it's very important that you have those levels optimized. Now, bodybuilders tend to have higher doses of synthetic hormones.
And that
Some of them,
aromatizes, right? And then into the estrogen itself, causing a
so
lot
they're
of side
making
effects.
all kinds of estrogen, not estradiol. They're making estrone and estriol in addition to estradiol. So they
Okay.
tend to have higher estrone and estriol and estradiol levels. So they have high estrogen levels. Because they're taking a synthetic, they will have higher incidences of side effects. And those side effects can range anywhere from gynecomastia to simple nipple tenderness to masses in your breast, and they can go all the way up, to uh, erectile function dysfunction, because these metabolites are causing problems at the cellular level. And that's the big problem with the synthetic testosterone. Not saying that that's not the best treatment. I do have treat patients that don't do very well with a cream or a gel, and they need to take, like, they have skin issues when they take it. So we do have some patients that need to be on the synthetic testosterone, but they can't have the higher doses. Now, with bodybuilders, they tend to have extremely high doses of synthetics. And
Right.
again, they're taking hormones from other animals in addition to testosterone levels.
Right.
So yes, they do need estrogen blockers, but the problem with that is you're not getting the beneficial effects of that estradiol, and you're getting all the bad effects of low estradiol and extremely high testosterone levels from a synthetic um, testosterone. So you get liver issues, which is a big problem with the bodybuilders,
Yeah.
and you get vascular issues, and a lot of them start to have kidney problems and all of that as they get older.
We see a lot of that where a lot of the bodybuilders are on dialysis, and they don't monitor their kidney function. Uh, Back to that gel, like, when I switched over and I chose the gel, I noticed that anytime I did a dose that was synthetic, that I would have sensitivity around my nipple area. Now I'm doing, several hundred milligrams a day, and I don't feel that. So that's because it's bioidentical as opposed to synthetic, because that's obviously, noticeable.
Because it's going into the receptor site and it fits exactly in that receptor site. So it's making the body think it belongs there.
Right.
So another thing
Yeah.
with the bioidenticals is you don't have to cycle on and cycle off because your body's not getting stressed from the high hormone levels as it does with a synthetic. One of the things that we're familiar with in the bodybuilder realm is going on cycle and off cycle. Well, the
Right.
beautiful part about a bioidentical is you never have to do that. We get most of our problems from the hormones, from the high and the low dosing, the ebb and flow, the high peaks and the low troughs. That's what's causing a lot of our feelings of not feeling comfortable in our own skin. We're
Right.
very used to that from when women are going through their changes in a monthly basis because of different hormone levels. As men, we're used to saying, "Oh man, I only have a normal girlfriend for a week and a half out of a
Right.
month." It's not their fault; it's that their hormone levels are changing.
I
So
think
once they go through a menopause and they have no hormones and are taking a hormone replacement and they get that stabilization, a lot of them feel a lot more comfortable in their own skin. And the same thing happens with men.
Yeah, they call that andropause, if I believe correctly. They call it basically fluctuating, and we see that also with a lot of a lot of people that have come to us. You tell them about like that they're given injections of cypionate like every 2 weeks. What's the problem with doing that and treating like that?
Then it's that high dose and the low dose. So if you think about it, testosterone cypionate generally has a half-life of anywhere from, they say 6, but I'd say closer to 8. So 6 to 8 days, which means half that dose is gone after 8 days, which
Wow.
means if you're waiting, this is 6 to 8 days, right? So if you're waiting 14 days for your next injection, you're bottoming out your testosterone levels.
Right.
Again, high dose to a very low dose. I don't know too many people that are on that type of regimen that feel very good that second week.
No,
Now,
definitely not.
the theory behind that is you're opening up all those receptor sites to accept that testosterone. In theory, that's true. But if it was a natural or a bioidentical hormone, you wouldn't need to empty out those receptor sites. You can fill them up and saturate them
Wow.
and feel just as good all the time. That's why I personally like the daily dosing of
Excellent.
a little bit higher levels.
All right. Well, I think we gave we went over a lot of different topics and a tremendous amount of information. So I'd like to leave a little bit more for the future discussions. I think people need to listen, digest this, start rethinking about what they think, what they think they know, right? Especially with a lot of misinformation out there. And hopefully we can bring more of this to light as we do further discussions and really, open up the eyes of a lot of people.
Well, I love your conversations that you've been able to post. It's been great working with you. Um, and just like Mike, that we're going to start pumping out with from Condemned Labs with his supplement line. It's been a real honor to speak to you guys about this stuff and educate you and work together
I'm definitely
on
learning a lot.
educating the population about what's really going on. And I love your term, bro science. So I think that's what we're gonna have to call our webinar series is
Yeah,
bro science, reality of bro science.
sounds good to me.
Right. All right. I'll talk to you soon.